This training is designed to provide an overview of the state's mental health system and your role and responsibilities as a regional commissioner. We are grateful for your service, and members of the Department of Mental Health are always available to answer any questions or concerns you may have. We'll start by talking about what is the state's mental health system. Although we have many providers of mental health, substance use, and IDD services in the state, Mississippi's mental health service delivery system is comprised of three major components. The first, state-operated programs and our community service programs. These are the programs directly operated by the Department of Mental Health. The next are regional community mental health centers, of which you provide oversight. And the third are other nonprofit, profit service agencies, and other organizations. Through the Department of Mental Health, the state operates behavioral health programs. There are 4 state hospitals and 1 psychiatric residential treatment facility for young people. Mississippi State Hospital in Rankin County provides acute psychiatric services, substance use disorder services for women, child and adolescent services, nursing home services, and forensic services, which typically involve individuals with a mental health disorder and involved in the criminal justice system. East Mississippi State Hospital in Meridian provides acute psychiatric services, substance use disorder services for men, nursing home services, and secure community living services for forensically involved patients. North Mississippi State Hospital in Tupelo and South Mississippi State Hospital in Purvis both provide acute psychiatric services and are 50-bed hospitals. Each hospital typically serves a designated catchment area, but accepts admissions from counties within those areas are statewide. In addition, Specialized Treatment Facility in Gulfport is what's known as a PRTF, a psychiatric residential treatment facility for young people that accepts admissions statewide. All admissions to the Department of Mental Health's state hospitals are handled through the court commitment process. Beginning July of 2024, the first step toward helping someone receive inpatient behavioral health services begins with a pre-affidavit screening that is conducted by the local community mental health center. If that evaluation results in a recommendation for further treatment, a judge will make a decision based on all the evidence presented as to whether treatment is necessary, and if so, at an inpatient or an outpatient program. Additionally, Mississippi law allows for a medical professional to initiate a 72-hour hold on an individual without the need for a warrant or court order if there is reason to believe that a person may harm themselves or others. Someone may be held in a hospital, crisis stabilization unit, or other medical facility. If necessary, the involuntary commitment process may be started by the court after the expiration of the 72 hours. State law also allows for commitment specifically for alcohol or drug addiction, including orders for outpatient treatment as an alternative to inpatient treatment. The Department of Mental Health also operates regional programs for individuals with intellectual and developmental disabilities. These programs provide 24-hour-a-day, 7-day-a-week residential services, both institutional and community, for people living with IDD. Programs are licensed as intermediate care facilities. They also offer diagnostic evaluations to determine eligibility for the ID-DD waiver. These programs include North Mississippi Regional Center in Oxford, Hudspeth Regional Center in Rankin County, Ellisville State School in Ellisville and its satellite program, South Mississippi Regional Center in Long Beach, and Boswell Regional Center in McGee with its satellite program, Mississippi Adolescent Center in Brookhaven, which provides specialized services for young people. Like the state hospitals, the state's regional programs serve designated counties, and Mississippi Adolescent Center accepts admissions statewide. Regional community mental health centers are established in state statute and serve designated counties. They make available a range of community services for mental health, intellectual and developmental disabilities, and substance use disorders. They operate under the supervision of you, a regional commission appointed by county boards of supervisors from their respective service areas. These commissions oversee the Community Mental Health Center, are responsible for hiring the executive director, approving policies, and providing oversight. The Community Mental Health regional structure has been through many changes, but there has been no loss to service provision to Mississippians. The regional commissions and the community mental health centers you oversee are part of local county government. As a commissioner, you provide oversight for the funds that are provided to your local community mental health center, and you have a role to play in ensuring that the community mental health center is meeting the needs of your community. The Department of Mental Health establishes minimum standards for certifying and monitoring the community mental health centers. Additionally, the department provides grant funding to the community mental health centers to provide specified services to the community. County governments are required to contribute at least 3/4 of a mill tax on all taxable property in the county as determined in either its 1982 fiscal year or the amount of funds the county contributed to the organization in fiscal year 1984, whichever is greater. In order for the community mental health centers to receive Department of Mental Health grant funding, county governments must contribute this base level of funds. Community mental health centers are the primary providers of community mental health services in Mississippi, and they serve as the gatekeepers for preventing, when able and appropriate, civil commitment to the highest level of care at a state-operated hospital. As a regional commissioner, it is your duty to administer mental health and intellectual and developmental disability programs certified and required by the State Board of Mental Health. The community mental health centers are required to provide core services for adult mental health services, children and youth mental health services, substance use disorder services, and intellectual and/or developmental disability services. Core services are established by the Department of Mental Health. The third part of the public mental health system in Mississippi is comprised of certified providers. These are for-profit and not-for-profit service agencies and organizations. They are certified by the Department of Mental Health and must meet operational standards as designated by the department. Certified providers may also receive some funding from the Department of Mental Health for certain services, but they are largely funded through other means. These providers offer community-based services for alcohol and drug treatment, adults, youth, mental health, and intellectual and developmental disabilities. The Department of Mental Health's mission is to provide hope by supporting a continuum of care for people with mental illness, alcohol and drug addiction, and intellectual and developmental disabilities. The goal of the service system is to have a full continuum of care for people in need of services. This continuum includes the 3 components of the service system we have discussed: the state programs, the regional community mental health centers, and certified providers. The Department of Mental Health believes in a person-centered system that reflects a person's individual needs and their progress in their recovery. Inpatient beds are only a part of that continuum, and many mental health issues can be treated in the community with local behavioral health providers. Mental health doesn't mean the same thing as mental illness. Our mental health is just one part of our overall health and wellness, and our mental health can affect our physical health. For instance, people who are depressed or chronically stressed may have a greater risk of physical illness. Exercising can directly lift our mood and help alleviate long-term depression. Poor sleep habits can translate to poor mental health. Mental health involves our daily life and how we're functioning in many different capacities. Our productivity, whether work, school, or other activities, healthy relationships, both personal and professional, our resilience and ability to adapt and cope with change and adversity. Our physical health and our mental health go hand in hand. When our mental health gets to the point where it's negatively affecting our everyday lives, we may have a diagnosable mental illness. The Department of Mental Health has a campaign called Think Again, encouraging people to think about their mental health with the same importance and focus they do their physical health. 1 out of every 5 U.S. adults experience a mental illness each year. That doesn't necessarily mean something like bipolar disorder, schizophrenia, or major depressive disorder. Those are considered a serious mental illness, or SMI, and around 1 out of every 20 adults has an SMI. In Mississippi, 120,000 adults have a serious mental illness. It's important to understand that mental illness is treatable, but Mississippians struggle to get the help they need. Of the 119,000 adults in Mississippi who did not receive needed mental health care, 47.9% did not because of cost. This is why services provided through the state and community mental health centers are so important. Community mental health centers provide services to Mississippians on a sliding scale fee and cannot discriminate based on someone's inability to pay. There are over 2 million people in Mississippi who live in a community that does not have enough mental health professionals. Intellectual and developmental disabilities are differences that are usually present at birth and that uniquely affect the trajectory of the individual's physical, intellectual, and/or emotional development. Many of these conditions affect multiple body parts or systems. Intellectual disability starts any time before a child turns 18 and is characterized by differences with both intellectual functioning or intelligence and adaptive behavior. The term developmental disabilities is a broader category of often lifelong challenges that can be intellectual, physical, or both. IDD is the term often used to describe situations in which intellectual disability and other disabilities are present. It might be helpful to think about IDDs in terms of the body parts or systems they affect and how they occur. For example, disorders can affect the nervous system. They affect how the brain, spinal cord, and nervous system function, which can affect intelligence and learning. The sensory system. These disorders affect the senses, sight, hearing, touch, taste, and smell, or how the brain processes or interprets information from the systems. Metabolism. These disorders affect how the body uses food and other materials for energy and growth. And degenerative. Individuals with degenerative disorders may seem or be typical at birth and may meet usual developmental milestones for a time, but then they experience disruptions in skills, abilities, and functions because of the condition. Addiction is defined as a chronic, relapsing disorder characterized by compulsive drug seeking and use despite adverse consequences. It is considered a brain disorder because it involves functional changes to brain circuits involved in reward, stress, and self-control. Those changes may last a long time after a person has stopped taking drugs. Addiction is a lot like other diseases, such as heart disease. Both disrupt the normal healthy functioning of an organ in the body, both have serious harmful effects, and both are, in many cases, preventable and treatable. If left untreated, they can last a lifetime and may lead to death. The decision to use drugs or alcohol is usually voluntary, but with ongoing use, it can affect someone's self-control. Some people may become addicted to drugs and alcohol while others don't. No single factor can determine whether someone will struggle with addiction. Risk factors and protective factors can play a role. Risk factors are those that can contribute to a greater chance of drug use or addiction. Protective factors are those that help reduce someone's risks. The Department of Mental Health believes in collaboration. We believe that services and supports are the shared responsibility of state and local governments, communities, family members, and service providers. Through open communication, we continuously build relationships and partnerships with the people and families we serve, communities, governmental and non-governmental entities, and other service providers to meet the needs of people. Everyone has a part to play: the state, county government, and communities, and you as a regional commissioner. One of DMH's core values is collaboration and the shared responsibility that comes along with that. There are multiple approaches to collaborate with partners and to coordinate services statewide, but the Department of Mental Health also has a statutory role to play in ensuring that core services are provided statewide, that treatment is implemented, and standards are developed and met by providers within the service delivery system. To coordinate services, the department provides funding, sets performance metrics, collects and publishes data, seeks input from individuals who utilize community services, and checks to determine if standards are being met by conducting site visits and also conducting fidelity reviews. The Mississippi Legislature provides funding to the Department of Mental Health through an appropriation each fiscal year. This funding comes with expectations, and agencies are required to specify how they will spend the funding. Additionally, the Department of Mental Health receives funding through federal grants. Each grant requires specific services or supports and also includes expectation and rules on how to spend the money. Both the Mississippi Legislature and leadership and federal grants require the agency to report on progress and provide data on the services funded. The community mental health centers receive funding from a variety of sources, including funding that is awarded to the community mental health centers through the Department of Mental Health as a subgrant. The funding is provided to the community mental health centers to provide specific services that are required by the Department of Mental Health. Each fiscal year, the community mental health centers must respond to requests for proposals sent by the department that outlines the goals of the funding, expectations, and performance measures. There are some services that are provided and funded statewide, and other grants fund services at specific community mental health centers. The Department of Mental Health also coordinates services provided throughout the state through our operational standards. The Department of Mental Health, through Section 4147 of the Mississippi Code, has standard setting authority. This authorizes the department to supervise, coordinate, and establish standards for all operations and activities of the state related to mental health and providing mental health services, to certify, coordinate, and establish operational standards, and establish required services for regional providers in intellectual disability, mental health, alcoholism, drug misuse, developmental disabilities, compulsive gambling, addictive disorders, and related services throughout the state, and establish and promulgate reasonable operational standards for the construction and operation of state and all DMH certified facilities. The operational standards can be found on the Department of Mental Health's website by clicking on the For Providers link and then Provider Documents. The most up-to-date version of the standards is posted. When a rule contained within the standards change, those changes are communicated through a provider bulletin. The provider bulletins can also be found on the department's website at www.dmh.ms.gov under the For Providers link. As a commissioner, accurate and easily accessible data is vital to your role and in making informed decisions. The Department of Mental Health and the Community Mental Health Centers collect and report on hundreds of metrics. Some reports are published annually, and sometimes the Department of Mental Health is asked to provide data or publish a report on a specific topic. These reports and corresponding data are published on our website at www.dmh.ms.gov. We'll look through a few examples of the data you can find in these published reports. The annual report provides an illustrated snapshot of key data points from the previous fiscal year. This is a great report to use when looking for quick and easy to understand data or to share highlights with others. The Adult Mental Health Services Data Report is published annually using the previous fiscal year's data, and it provides a comprehensive review of data from the state-operated behavioral health programs and adult mental health services by the community mental health centers. Data validation and reconciliation occurs quarterly with each community mental health center, and the Community Mental Health Center Executive Director or their proxy sign reports indicating the accuracy of the information. The Audit and Fidelity Report contains information regarding utilization review audit data, behavioral health services fidelity review data, and mobile crisis response fidelity review data. During the 2024 legislative session, House Bill 1640 was signed into law, which amended many aspects of the civil commitment process. It placed restrictions on the use of jail as a waiting location for an individual involved in the civil commitment process, and it included a new reporting requirement of the community mental health centers. Each quarter, the community mental health centers shall report to the Board of Supervisors in each county in its region the following information: the occupancy percentages reported by the Crisis Stabilization Unit in the region, the number of individuals held in jail after the commitment process has been initiated, and the number of individuals the Community Mental Health Center provided treatment to while they were in jail, the number of pre-affidavit screenings conducted, the number of individuals diverted to a lesser restrictive alternative from commitment, the number of Crisis Stabilization Unit denials and the reason for denial, a summary report of Medicaid claims, including denials, and cash balance as of the date of the end of the quarter. The Community Mental Health Center shall provide the Department of Mental Health, local sheriffs, and Chancery Court judges with a copy of the report each quarter. Another element in the state's goal of an accessible and coordinated service delivery system is the Coordinator of Mental Health Accessibility, which is employed through the Department of Finance and Administration. The coordinator has a statutory obligation to perform a comprehensive review of the mental health system to determine if services are offered in each county and available to the entire population, especially to those with serious and persistent mental illness. The coordinator analyzes and reviews the structure of the mental health system, reviews the adequacy and quality of the individualized supports and services that are provided to people discharged from the state hospital or to people who are at risk of institutionalization, to review quarterly financial statements and status reports of the community mental health centers, and to consult with state agencies and mental health stakeholders regarding the status of services offered, to determine where the delivery or availability of mental health services are inadequate, to determine whether each community mental health center has sufficient funds to provide required mental health services, to provide quarterly reports on the status, and to provide the peer committee with a financial report, assessment and review of each community mental health center region and services, with other findings on other relevant matters. Now we'll talk a little bit about the authority and scope of responsibility of commissioners and community mental health centers. You can find this information in sections 41-1931 through 41-1943 of the Mississippi Code. The community mental health movement began in the United States in 1963 when President Kennedy signed the Community Mental Health Act. Community mental health centers arose in towns and cities throughout the country, and it moved thousands of individuals out of psychiatric institutions and into treatment in their home communities nationwide. The Mississippi State Legislature passed the Regional Commission Act of 1972 to organize its own community mental health centers here in the state. Community mental health centers are guided by both federal and state regulations. The boards of supervisors may act singularly or as a group in the selection of a regional district when establishing a community mental health center. Once the regional community mental health center is established, a regional commission is composed of members appointed by the boards of supervisors. During the 2023 legislative session, an important addition to Section 41-1933 was added. It requires that each regional commission employ or contract with an accountant for the purpose of managing the finances of the commission. The accountant shall provide an annual audit to the commission in addition to his or her other duties. Section 41-1935 provides that the Board of Supervisors of each participating county in the program shall appoint one member to the Regional Commission in its respective region for a term of 4 years, who shall serve at the will and pleasure of the appointing Board of Supervisors, and may be a clerk, sheriff, or deputy. In addition, the chancery clerks of the counties in each region shall select a chancery clerk or deputy clerk to serve as a non-voting liaison to the commission, and the sheriffs of the counties in each region shall select a sheriff or a deputy sheriff to serve as a non-voting liaison to the commission. So a clerk, sheriff, or deputy can be a voting member if appointed by the Board of Supervisors for their regional commissioner position. But if a clerk, sheriff, or their deputy is selected by the chancery clerks and sheriffs of the counties to represent them, these members serve as a non-voting liaison. Section 41-1933 lists the authority and responsibilities of regional commissions, some of which are highlighted here. This is not an exhaustive list of all responsibilities and authority that is listed in statute, but we'll go over a few of these, such as to establish, own, lease, acquire, construct, build, operate, and maintain facilities and services. Regional commissions have the responsibility to promote increased understanding of the problems of mental illness, intellectual disabilities, alcoholism, developmental and learning disabilities, narcotic addiction, and drug abuse. To make purchases and enter into contracts for purchasing in compliance with the public purchasing law. To meet at least annually with the Board of Supervisors of each county in its region for the purpose of presenting its total annual budget and total service system. To enter into managed care contracts. To acquire whatever hazard, casualty, or workers' compensation insurance that may be necessary. And to ensure that all funds are used for the benefit of persons with mental illness, IDD, and substance abuse. We'll go over two specific requirements of regional commissions in a little more detail. The first, dealing with the requirement of an annual operational plan. By July 1st each year, regional commissions must submit an annual operational plan and financial statements to the department for approval. The plan must state which services the Community Mental Health Center will provide and not provide. If deficiencies are found in the plan, the Community Mental Health Center or community service provider is given a 6-month probationary period to bring its standards and services up to the established minimum standards and required services. While on probation, the Regional Commission shall develop a sustainability business plan within 30 days of being placed on probation and must be signed by all commissioners. After the 6-month probation, if the department determines the center still does not meet the minimum standards and required services, the department may remove certification of the commission, and that provider shall be ineligible for state funds from Medicaid reimbursements or other funding sources for those services. After the 6-month period, DMH may identify an appropriate community service provider to provide any core services in that county that are not provided by a community mental health center. At any time a regional commission or other related organization accumulates surplus funds in excess of 1/2 of its annual operating budget, the entity must submit a plan to the Department of Mental Health that states the capital improvements or other projects that require such surplus accumulation. If the required plan is not submitted within 45 days of the end of the applicable fiscal year, the Department of Mental Health shall withhold all state appropriated funds from such regional commission until such time as the capital improvement plan is submitted. If the submitted capital improvement plan is not accepted by the department, the surplus funds shall be expended by the regional commission in the local mental health region on group homes for persons with mental illness, persons with an intellectual disability, substance abusers, children, or other mental health and intellectual and disability services approved by the Department of Mental Health. So as a quick review and summary of key responsibilities of commissioners, here are a few reminders. You serve as the governing authority for your community mental health center and must adopt policies as such. You should keep written documentation of your annual review of the budget, written affiliation agreements, changes in policies and procedures, submission of the annual operations plan to the department, the disaster and continuity of operations plan, the process for meaningful individual and family involvement in service provision, and your evaluation of the executive director. You should also maintain written documentation of public education activities, documentation of insurance, and written approval provided by the Department of Mental Health and our county for disposal of property. It's also important to know that some actions require prior written approval from the Department of Mental Health if that action affects more than one region, such as managed care contracts, providing services or facilities on a discounted basis, if entering into an agreement where the Commission assumes financial risk for provision of delivery services, if providing direct or indirect funding for any HMO, or if establishing, operating, or the Commission is a member of any managed care entity. There are two types of training that the Department of Mental Health has to offer and that commissioners must participate in. The first is orientation training to all new commissioners and regional commissions, which is this presentation. And the department provides annual training for all commissioners with continuing education regarding the Mississippi mental health system and services as developed by the Department of Mental Health. The training shall be provided at the expense of the department, except for travel expenses which shall be paid by the regional commission. These annual trainings are usually conducted during the annual commissioner meeting and recorded and provided for those commissioners who could not attend. The Department of Mental Health has the responsibility to notify the Board of Supervisors when a commissioner does not attend either the orientation training or annual training. The Board of Supervisors shall remove the commissioner unless the department and the commission agree to allow the commissioner to serve until the next opportunity to attend the training. We have talked a good bit about the service delivery system and your roles and responsibilities as a commissioner, but it's also important to be aware of the important services and supports provided by your community mental health center. We will focus on specific services during annual trainings, but it's good to be familiar with the services that your community mental health center provides to help make a difference in the lives of Mississippians with mental illness, substance use disorder, and/or intellectual and developmental disabilities. Two resources that Mississippians can use to find services statewide are the Mental Health Mississippi, which is both a website and a phone app, and the Department of Mental Health helpline. Through Mental Health Mississippi, people can find local services, including crisis services, and the site also has a glossary so that people can understand what some of these services are and learn more about them. You can also call the Department of Mental Health helpline at 1-877-210-8513. You can find more information about services near you through the helpline, but also can register a concern or a grievance related to a Department of Mental Health certified provider. We appreciate you taking the time to learn more about the public mental health system and your roles and responsibilities as a commissioner. If you ever have any questions, please do not hesitate to reach out to a member of the Department of Mental Health.